Welcome back to McLaren Port Huron's Today's Health program. Today we're speaking about anxiety, and joining me now is licensed social worker and therapist at McLaren Port Huron's Outpatient Counseling Center, Chris Mullin. Chris, welcome to Today's Health.
Hi Michelle, thanks for having me.
Now before the break, Dr. Brozovich talked about some treatment options for anxiety, including medications. What other treatment options are available for those that are suffering from anxiety?
So in addition to the medication management portion of treatment, we also offer individual counseling or couples counseling, family counseling, and group counseling. So counseling or therapy, really what talk therapy is just an opportunity to talk with someone either on an individual basis or with your partner, or as part of a family unit to address some of the complications or issues that someone might be facing. And in addition to those formats, we also offer group therapy that has certain topics that are focused on for a period of 5 or 6 weeks, so that folks can have some opportunity to talk with other people who might also be struggling with some of the same issues in a supportive, structured format.
How does therapy help with anxiety?
Well, therapy is a safe place for someone to talk about what the issues are that they're dealing with, or what the stressors or anxieties are that they're dealing with. Whatever's talked about in a counseling session remains confidential, so the patient or client can know that their information is safe, and it's an opportunity to identify what some of the issues might be that they're struggling with, some of the triggers for their experiences of anxiety, and a space to come up with some tools or some ways to work at reducing that anxiety and finding some solutions to some of the things that they might be struggling with.
Now, how important is it to, after you identify some of these tools to help with the coping of anxiety, to practice those tools?
That's a good question. So part of what we do in therapy sessions is assign homework. So that's a way for outside of the session for the patient or client to continue to practice on and work on some of the things that have been worked on in session, so that they can kind of go out into their world, try things a little bit, and come back to the therapy session and look at what worked, what didn't work, and hopefully to give them the tools to be able to successfully navigate their world with less anxiety.
Now, if somebody at home is watching this program and they are concerned about a loved one who they think is experiencing symptoms of anxiety, what should they do?
First and foremost, they should talk to the person they're concerned about, and then they can maybe offer to help that person find some treatment. I think making that first phone call often is the most difficult part of seeking treatment for someone. So help them set up an appointment, maybe offer to go with them to that appointment or first couple of appointments. Another big thing around pursuing treatment for mental health issues is stigma. So if, as someone who's struggling with a mental health issue, they know that friends or family are aware of what they're struggling with and still ready and available to support them, that helps reduce the stigma, which can reduce some of the barriers to seeking treatment and ultimately to getting help and getting better.
Now, in dealing with anxiety, are there any do's or don'ts that you can recommend?
Yeah, some of the things definitely to avoid are stimulants. So I think sometimes we forget that caffeine is a stimulant. So if you're already feeling anxious, having too much caffeine can be something that can worsen or heighten the anxiety. Nicotine is also a stimulant, so trying to avoid smoking would be another good option. And simply just saying no to things. Taking on too much is, I think, often an issue for a lot of us, and if we continue to say yes and take on more than we're capable of taking on, ultimately the anxiety is going to get in the way, and it's going to take over. Some things maybe to do are really work on consistency, work on routine. Sleeping is an important way to combat anxiety in a healthy way. So getting a good night's sleep, getting up at the same time every day, going to bed at the same time every night, trying to eat regular meals, and exercise, staying active, and reaching out also for support to friends, to family, to providers.
So a lot of the do's that you're mentioning and the don'ts are things that also apply, interestingly, to your physical and medical health. So what's good for your mental health is also good for your physical health, and vice versa.
Absolutely, absolutely.
Chris, this has been great information. Do you have any closing comments for our viewers?
I think anxiety is something that we all experience in different parts of our day or week or month or our lifetime. So anyone can seek treatment with a mental health provider. And specifically at, we offer treatment through McLaren Hospital at the Outpatient Counseling Center. Seeking treatment for any of the stresses or anxieties that you might be facing is a good source to get better. But if your stress or your anxiety is getting to the point that it's getting in the way of your ability to attend to day-to-day tasks, that's a really good indicator that you should seek treatment.
Chris, that's been great information. Thank you for joining us today.
Thanks.
And thank you for watching. If you have questions, need a physician referral, or have suggestions for topics you'd like to hear more about, you can contact us by calling Health Access at 1-800-228-1484. You can also watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.